Thankful for your support and your input. Okay, again, I'm gonna be stretching really good here. Trayvon, how are you holding up? Okay.
Yeah.
Okay. Make sure that we get these pores cleaned out for him. You know, I kind of go back and forth as I see something catches my eye, but you know, this area, it's an area that sometimes gets neglected because it's just these little corners, but oils settle in those areas, and you will see, like this one I'm about to extract, you know, it's just sitting there, and it can get pretty big if you don't catch it. So that's that. Oops. Go back and make sure it's clean. Okay, and I'm gonna go through this area through here, and you can see there's accumulation of some activity here with blackhead. So what I'm also gonna do is I am gonna probe these. I really don't want Trayvon to have to go through any discomfort, and you always want to open them anyway, but some of them are ready to come out without opening them, but I just want to double check. So I had a question that was put in the comment area, and it was, why do you always say bevel up? The bevel helps to scoop what's in there, okay? If you do it this way, you're gonna push it down inward, okay? So this one helps it to kind of pull it out. So that's why we do a bevel up. That way we just wanted you to know. Good question. These are really tiny. And so when you're extracting these small blackheads, gotta get right in there on that base so they'll come back up, okay? And double check around the brow area where there's hair, because it can sneak in there too. And I'm gonna push again and kind of pull and stretch, and there we go. These are really deep, and I'm stretching. And there we go. Trayvon, did you hear it pop?
Mm-hmm.
I'll make sure that we ice him down after we're done. So when doing extractions, you can also ice the skin down to bring the inflammation down pretty quickly. Okay, and you can see bevel up. And when you do the bevel, you can actually get the whole thing out. See? Okay, so that's why we say bevel up. So I'm gonna go back just to make sure everything is cleaned out of there. Okay, that's clean, and this one has a little bit in there. Okay. Go on another angle, and that way you can get this out. I'm going to go ahead and wash the skin again, just to cut a little bit of the oil and get that skin a little bit more dry. It's pretty oily today. It's not humid outside, I don't think. I haven't been. We get here early and we leave late, so. But he's pretty oily, so I'm going to go ahead and cleanse his skin. And when I cleanse the skin, I love to use a 4x4, but we also use a Clarisonic brush. We recommend it especially for home use. So you can really get in there and get it cleaned really nice, because it pushes the cleanser into the skin. And it has settings that you can use according to what you're needing. Okay, so we're gonna go ahead and wash this really good. Rinse. And this again will help pre-soften these for me. I just don't want to put so much pressure on him. We love Draven around here. We don't want him to be unhappy. Okay, so here we go. Okay, I'm going to stretch, bevel up, bevel up. So a lot of times they're just kind of hiding underneath there, and you just want to go right underneath that skin and get them out. There we go. Okay, I'm gonna go through here. Another reason why we wash the area is because you don't want to spread that bacteria all over the place, you know? You just want to keep your area nice and clean. So for the estheticians that are working and watching our videos, you want to make sure you always keep your area clean. And even for home use, the same way. Okay, so here you have a little blackhead and then you have a pustule. Okay, I don't know if you saw the way I did this, but this one I went this way, this one I went this out, and without pushing it inward. So it would bring the content up to the surface. Okay, so it's got a lot of an inflammatory lesions through here. I'm gonna go through the non-inflammatory and gently get those for him. So we're gonna continue on this side here, the temple. These are pretty receptive. So I went ahead and washed the skin with a glycolic cleanser. And again, that pre-softens those blackheads, so it makes it a lot easier for them to come up. Okay, so this one is more of a little cyst. Okay, these little tiny ones, I'm gonna go ahead and open these up. I know that you guys have been asking about the wash, and it's been a little hard for me to get it off the ground and into you guys' hands. So I will definitely keep you updated. I'm really shooting for September and see if we can get it to you guys. Today, again, I'm just working on blackheads first. When there is an inflammatory one, do you see how I push it out this way? Never go in, always go out whenever you're looking at these type of lesions. And you can see how it popped out really quickly. Because if you go in, you cause a lot of trauma to the skin, and you don't want to do that. And then here you go inward, okay? How are you holding up, my friend? Okay, and it's there to the side, and it's out. Okay, I'm going to work in this area now. Again, bevel up, break up the content. So there's right here, you can see where it's healing. It's kind of purple. I'm going to try to go on the side, and you're gonna see that's most likely it'll pop. There you go. And there's stuff in there already, okay? When you see him again next week, it's not gonna look like that. It'll look really nice. And smooth that. That color's not gonna be there. Wash that area again. Just want to make sure it stays clean. Okay, so this one probably will do the same thing as the one we had before where they'll bleed, but we'll see what happens. So when you're doing this area, we've talked about this in the past again, but just you have to be very careful the way you extract, because this area, it's very vascular, and if you have a cyst in that area, that bacteria can go in and cause some problems. So you have to be very, very careful. What I'm doing is really cleaning those corners through there. So this area again, it gets a lot of accumulation of oils. So to make sure that it gets cleaned up really good. Stretch and get into that right in that base. And like I've said before, I really use my fingers to really feel how much impaction is in there. And you can actually feel it. So that gives you kind of a guide where you still need to extract, because you can feel that the pores are still filled up. Can you breathe okay? Okay. I'm going to work work on this little area through here. So do you see that area there? That's also filled up with bacteria. And needs to be cleaned out, because if you don't, what'll happen is it'll cause scarring. You need to be very careful the way you clean those out. We use ice, of course, to get the inflammatory response down. So we went ahead and cleaned this area up, and you can see it's already calming down. It's not as elevated. I'm gonna go through this other area through here, and you can see it's very clogged. I've been just kind of talking to him about because he looks a little bit more clogged than usual. We had him much clearer, and so he ran out of his moisturizer and he was using something else, and that also can contribute to him getting clogged. So we're gonna get him back on track. I told him if he runs out of something, just to let me know. I will get it to him in a heartbeat, and because I want him to look good, and he's got a goal and I got a goal. My goal is I want him to have clear skin before school starts, and his goal is the same thing, right? Yeah. So we got to work together as a team. I did talk to Daryl the other day, and he seems to be doing better. And I think he had 2 more chemos to go. And I told him we needed to celebrate, and he said yes. So I'm looking forward to that. And he's going to ask his doctor when he can come back so I can start treatments on him again. So I won't do him until he gets released by his doctor. But I miss him. I miss my friend. And I'm looking forward to spending a little bit of time with him. Just kind of catching up. And I promised you guys a video for like a interview type of thing. And we are going to do that. So these again are real small blackheads. Okay, you're gonna see that. That one we gotta drain out. I think we're gonna be experiencing problems with blackheads. As you can see, I started him on the glycolic wash, and I knew I was gonna run a risk of this getting better, and so I asked Justin, how did your skin get better?
Yes, it did.
So basically they were a lot bigger, but that's okay. That's my goal, is to make sure that they get better. But we're gonna be extracting today and getting them all out. And so usually when we're doing a lot of blackheads, it's because maybe sometimes puberty and so forth and so on. With him, it's actually, he's got the most beautiful head of hair I've ever seen. These amazing locks, and they fall like down to here. And so in the summer he sweats a little more than he does in the winter. He's mostly outside a lot, and so that's what causes the problem. He gets a lot of oils, oxygen doesn't go into that area, and of course it causes him to clog. So he should resolve pretty quickly, and so we'll see how his first session goes. So thank you, Justin, for allowing me to work on your skin.
Thank you.
So we're gonna start. We're gonna work at the base, And they're pretty receptive. How are you holding up, okay?
Yes, ma'am.
So this is about the pressure that we're gonna use, okay? If for whatever reason you find that it's too much, just raise your hand and then I'll back off, okay?
Okay.
A lot of you have been asking about Kay, and I'll be seeing him tomorrow. Of course, by the time we load this up, tomorrow will be a different day. But so he's coming in. He's been busy with school, and so he hadn't been able to come in, but I can't wait to see him. I talked to his mom. They're doing great. He's doing good, and he's clearing up nicely, which that's what we want. So before I started, I did wash his face. Might have mentioned that a little bit earlier, but just in case if I didn't. 20% acid wash. I vigorously scrubbed it on the skin. I know you guys have been calling and writing and requesting my wash. Should have it back in stock soon. Okay, remember it's all about getting right there on that base of that pore, and that way it'll release all the buildup that's underneath there. I had a question too, which was how much I got paid. Is that what it was, Jody? Something like that. And I don't get paid for doing this, so that way you guys know this. I do this because I thoroughly enjoy my work. It's real hard sometimes to even leave work, or even when a patient comes in, and we usually work on them for about an hour, and it's real hard for me just to even let them go because I want to keep working on their skin. But so I don't charge for they don't give me any money, sorry, for doing any of the videos. Another thing I wanted to talk to you guys about, I need to sit down probably sometime next week and go through some of my emails. I have read them, and you probably have noticed it, but I have not had the chance to respond to them. And so please don't think that I will not respond. I will. It's just that Jody was on vacation. Yay! Well-earned vacation. And so I've just been really busy, and her and Griselle, my other reception in the front, they are just so amazing. Let me open this up here. And they help me a lot, and so it's just been a little hectic, but I will definitely answer many of those emails that have come in, and questions, so forth and so on. Okay, thank you for reaching out to me. I truly appreciate it. I am honored. Okay, so you could see, I don't know if you can see the difference between this area and this area. See how it's nicely cleaning up? Just awesome. And then we'll just keep working. I'm telling you, this is the best job ever. I know some of you are wanting to get into aesthetic school. I would definitely recommend it. It's a very rewarding profession, especially if you're a popaholic. So at this point, I am going to wash the skin again. And that's just to help pre-soften that area. Anytime I use the wash, now before when I was videoing before, I wouldn't show it, but you guys also wanted to see that. So part of the process. So when I wash, I do wash very vigorously. You want to get that glycolic in there, okay? Now, Justin, you're gonna feel it a little bit, okay?
Okay.
All right. And so that helps to bring to the surface all that oil and content in that pore. And you can see it, how it kind of puffs up. You okay?
Yes, ma'am.
All right. And there we go. I'm gonna try to get these little tiny ones through here. I know you said you really didn't want to talk much, but it's just a question, okay? So you're graduating from high school. You're in the 11th grade, but you're also going to college at the same time, right?
Yes.
So what are you wanting to do when what have you chosen as a profession?
Well, I want to do plastic surgery.
Yay! Isn't that awesome? That's such a great profession to have. So I'm really excited for you. You invite me to your graduation, okay?
Okay.
All right. So you go back and you double check, make sure that it's nice and clean. I'm gonna just wash this area. So this is a little stubborn, Justin, okay? But it came out. You okay?
Okay.
Survived?
Yeah. Mm-hmm.
All right. Go ahead and open some of these. It's a little bony area here, the forehead, so it can be a little bit uncomfortable. So I'm gonna try to make it as comfortable as I can, okay? Not a lot of fatty tissue here. just kind of open some of these. They're very small. We're going to stretch, go on that base, stretch on that base, stretch, and on that base. Okay, go on that base. I'm going to wash a little bit again. Okay, I'm going to just double check through here. Like I said, this is kind of like a very bony area, and you can see I asked you what you did this weekend, and you were saying that you really had to do a lot of studying.
Yes.
I know that it'll pay off.
Hopefully one day.
It will. It definitely will. So how's your skin doing overall?
Much better.
Awesome. We always say that, but we love to hear that. They are so much smaller, and his skin is, I could tell already, it's gotten clearer. So what I'm doing is just going over the area on the forehead that we were working on the last time, and finishing up cleaning that area for him. The blackheads are smaller, so anytime you use any type of keratolytic, which would be a glycolic, retinol, retin-A, it's going to buffer down that keratin within the follicle and start smoothing out that skin, and of course it makes those blackheads a little bit smaller, but you still need to go ahead and remove the contents in there, so that way the pore's completely out and it doesn't give it the opportunity for it to grow and fester. Okay, washing your skin is so important, and he's doing a great job at following directives, and I love that. So even though I am, teaching the technique of extracting properly, I do want to be just cautious on, letting you guys know that always leave it to the professional when you are extracting, because you don't want to do it wrong and then cause yourself to scar. But this technique is so much easier, and it does not cause as much trauma to the skin as using other techniques. Okay, I just wanted to kind of let you guys know that. Okay, right at that base. Holding up okay?
Yes, ma'am.
All right. I did went ahead and washed the skin and decap those follicles. And I used 27 1/2-inch needle. Did you just wink?
By accident.
Okay. I'll make sure you're okay though. Okay, so we're going right here at the base, and you'll see there's kind of two of them. Go ahead and open up some more here, and then I'm also going to do the wash again. So many of you have asked about the wash, and I'm currently sold out of everything that I have in stock, and I'm going to have to redo my packaging and reorder. And so my website is going to be www.hnilsa.com, but my also for the retail part of it is going to be www.thequeenofpops.com. So you will be able to order not only my wash, but also be able to order the some t-shirts and some other stuff that we are going to be retailing out of there. Okay, right now what the promotion that we have going on are the t-shirts, so that I can raise enough money to meet the demands. I just kind of so blown away at everyone's response to this channel. And my wildest dream would have ever even thought that we will be able to get such an amazing response. So if you're interested in ordering, you could definitely order it through website, and I will definitely put that out in our, not this video, but the next coming video. I think we'll come up with something soon, so that you'll be able to purchase the t-shirts. Okay, I did have this one comment that I thought was really cute, and so the comment was this. She said she notices that I open these little blackheads up, and many times I lose my area where I start. And it's so true, especially if I have a lot of blackheads and there's not any bleeding or anything. I totally lose my space. So I'm human, so I count on you guys to be my eyes in the sense that you guys will always comment on it. So thank you for that constructive comment. I'm working like a little graph in sections to try to keep that from happening. If it happens, I'm sorry. But yeah, I do get lost. And sometimes I do have squirrel moments. Okay, so let's go ahead and put a little pressure there. I am going to go ahead and wash his skin again. So I was asked what percentage. It is the 20% that we always use here at the center. And it lathers up, and you could see as it's lathering up, it's breaking up all of the keratin within the follicle to help release the contents that's in that pore. Okay, I've had many of you also suggest like using steam. A lot of times when we work in medical aesthetics, we don't use steam, and now there are so many that do, but there are many of us that don't. And the reason why is because working on different types of skin, whenever you're using steam or hot water, it can actually stimulate the melanocyte and cause a little bit of more problems with post-inflammatory condition. So by using a glycolic, because the molecule is smaller, it penetrates much quicker than what the steam can, and that's why we use it. Okay, so that's just kind of a tip for you guys. So now I'm going to go ahead and stretch that skin, and I'll do this real quick. Barely, it's very small, but as you see it coming out, it's bigger. Okay. Okay, I'm gonna go around this area. Okay, so one of the questions that I was asked was, do any of my clients ever watch their, their own videos? Justin, would you like to answer that?
Yes, I watched my video like 100 times over already.
Awesome, yay! And so, what do you think?
I don't know. It's kind of nasty knowing that it's coming from me, but it's very cool to watch.
All right. And I had asked you if people recognize you, and you said not really.
No.
No. Some of your friends think that you're brave.
Yes, but I don't really mind.
So yes, the only one that doesn't watch his videos is Daryl. He loves to read his comments, but he says he cannot watch his own videos. It's real hard for him. And so he just reads the comments. He should be coming in soon too. So this is a really bony area, so not a lot of fatty tissue. So there's a little bit of pressure there. Sometimes you get them way up there in the hairline, so I want to make sure it all comes out. So finally, we got cold weather. So it should be in like 40s tomorrow, and it'll be sunny again this weekend. Okay, I'm going to be working on the right temple here. Skin's looking really nice. He's pretty clogged, and we cleaned this out last time, and so he's got a couple little blackheads that I'm going to go ahead and just remove. But it looks really good. So now we're going to work on this side. I wanted to share with you guys on a message that I got, an email not too long ago, and it was so touching. This message came from Lena. I won't say your last name just so that way it'll keep your privacy. But Lena sent a message to me saying that she loves her sister as much as she loves watching my videos and popping blackheads, as much as I love popping blackheads, which I absolutely love. So she wanted me to give a shout out to her sister. So I'm going to give a shout out to her sister, and her sister lives in Mississippi Gulf Coast, and her name is, and I'm trying to read it here, so I apologize, you guys. So her name is Jorda, and so your sister wants you to know how much she loves you, and she wanted me to do a shout out. So thank you for watching my videos, and even though you guys are from one end to the other of the states, you have something in common to share, and that's pretty awesome. So thank you, ladies, for being a part of this amazing family. I tell you, we have the most wonderful group ever, and so I'm grateful for you guys. So I'm gonna stretch again, and you could see it's pretty clogged, so but Justin, it's gonna clear up real quick. Okay,
Okay.
all right. You're gonna feel it a little bit. Do you remember last time, this area?
Yes, I do.
Okay, so it's about the same. So okay, and then we're gonna stretch right on that base. Stretch right on that base. Stretch right on that base. To make sure this is all nice and clean, and you can see there's still contents underneath there, so holding up okay?
Yes, ma'am.
This is, and I always say, that's such a sensitive area. Okay, I'm going to stretch. As you can see, it's getting better. It's clearing up. You know, we're emptying out everything. Okay, we're going to go on the other side, which would be the left side. Let's see if we can match you up. What do you think? I don't want to walk to school like lopsided. No. I've had a question I just thought about. I've had several of you guys ask if we recommend Accutane. That is something that really has to be discussed with their primary doctor, and look at the contraindications, look at the risk factors. There's a lot that they have to consider, and as a family they would have to make that decision. So that's an option that's available to them through their physician, but we don't encourage it either way. We leave that up to them. I'd rather go, there are times that really I know that patients really need to be on antibiotics and be on something really stronger than what we could do here. And definitely I would say, you know, I'm not a physician, and you know, Dr. Brandon will talk to you guys and we'll kind of lay out what she thinks. But definitely that's something that you may want to consider, is getting on some antibiotics because of the type of acne that you have. Because our goal is that we don't want any of our, you know, young students, adults to suffer from acne and scar. So we want to make sure that they get cleared up. a lot of the students that have already come to me have tried those medications and it has not worked for them, and using more of a natural approach to managing acne has been a resort. Did you ever take any antibiotics or anything like that?
Never.
No. Okay. I know your mom is not into taking antibiotics. We've talked about it before. I remember we talked about that acne. It's not a bacterial problem, but it's a exfoliating problem. It's a problem where the body sheds too many dead skin cells and it gets trapped within the follicle, creating this plug, and from there it becomes an acne lesion. So if we can manage the skin by exfoliating it and turning those cells over and removing those sticky cells, I think we can get some really good results. One's my favorite, I just know it. But anyway, she's here. She was gone for a little while. Her first video is under extractions on a 67-year-old female, I think is what we put. So you can look her up on the first video. But I'm so glad she's back. She was in Puerto Rico and she came back, and we're gonna continue doing the second part of her treatment. I'm dermaplaning her because I really want to remove a lot of that buildup of dead skin cells. I just want to do a little bit of a recap. She is a smoker, and so with that, she does have a lot of comedones on her skin. She spent a lot of time in the sun, so she has what we call solar comedone condition, and I'll show you that in a few minutes. But I am going to go ahead and just remove all this buildup of dead skin cells. So I'll keep doing that, and then once I'm finished, then I'll start with the extractions, and we'll see you in a little bit. Okay, so I dermaplaned her, and so I'm going to go ahead and open up these little areas and extract. Today is a beautiful, absolutely gorgeous, sunny day. I always used to think that Florida was the place where you got, sun in the winter, but you know what? We're almost there, huh? So these areas that can accumulate, build up, and so especially make sure that you just cleanse the skin really well. And then just got a little blackhead here, another one here. So now I'm just going to be checking the skin, and just wherever I see some little blackheads, I'm right on the cheek area. I'm going to go ahead and extract. So she hasn't done much. I asked her if she had gone somewhere to get extractions done while she was in Puerto Rico, and she said no. So her skin held up pretty well, I think, So I'm going to go ahead and open these up for her. Somebody had asked why we use the bevel up. If you could see it, there's a little opening, and that helps to scoop the content out, and that's why we do the bevel up. It's like a little shovel. I'm gonna go in through here. You don't have to, you just go right on that outer perimeter of that pore. You don't have to dig in there. Sometimes you have to open it a little bit more, but for the most part, just go right on that outer perimeter of that pore. And when you go to extract, it should be pretty easy. These are itty bitty ones. ¿Cómo está, señora?
Bien.
Me alegro. No quiero que le duela. Okay. I'm just gonna go right along the side here. Stretch that skin. Right in here, stretch that skin. Stretch and go right on the base. Like I always say, really is all about getting that cotton tip applicator on that base of that pore, and then it will release. So stretch, and there we go. Again, stretch. Gonna make sure it's clean. Okay, now right here, I'm gonna go ahead and get those in that area. It's amazing how that glycolic wash can change the texture even just by using it here. It's awesome. This is a little cherry angioma, but it does have a little bit of content in there. Okay, I'm gonna go ahead and go to the nose area, and you can see there's some bigger comedones there. Okay, so what I'm gonna do is go ahead and probe those. Quiero que te quedes sin suspiro. So it's a little bit uncomfortable for her, but we're going to try to be as gentle as possible. I'm going to try to open these. Just told her we have a little bit more to go in this area to do extractions. I'm going to go here. It's a little bit more stubborn, and here we go. Again on that base, and here we go. So this one here, it's got a little bit of an angle, and let's see if I can get this out for her. It's almost out. There it is. Okay, now I'm going to go in these little corners here and get these itty bitty tiny ones. And use your fingers to kind of manipulate that skin, because you really want that skin to be flat so it doesn't fold over. So just take your finger and stretch, and that way you can really clean that area up for that patient slash client. Okay, now this is a little part that's a little painful. I'm going to try to go very gently and lightly, but I do want to clean this out for her. Just getting these little tiny vellus hairs right on that vermilion line, and you can see there's a blackhead there. We're going to go ahead and get it. So I'm going to probe first, stretch, get right there. Now I always like to go back and just kind of double check, make sure everything is out. Okay. All is good. This is just a little mole right there. Okay, so I'm gonna double check through here, and you can see that she's got some stretch the skin, and there it goes. And there goes the lawnmower. See, that's Texas for you. Somewhere else they're plowing snow, we're cutting our grass. So I'm gonna go ahead and do these. All right, so just asked her if she's doing okay. She said yes. Well, she said she's surviving. But she's doing really good. I feel really good from the last time I did extractions on her. So we're gonna go ahead and open these up.